Good afternoon, everyone. This is Bob Burge with the Indiana Department of Workforce Development. Thanks for joining us today. We've got a very special virtual job fair with our friends from IU Health. So we're going to get started in just a minute. I got a couple housekeeping items that I need to do. We have a lot of people signed up for today, which is very exciting news. And but first, I'm going to stall for just a second. I can see a lot of them are still just logging on, and so a couple housekeeping items with your audio. If you're having any audio issues, there's two different ways you can get audio. You can go through the voice over IP directly through your laptop or your phone, and or you can use the dial-in. There's a number. That's what I'm doing right now. There's a number you can dial in that way. So sometimes you may experience feedback, and often that is when there's two of you together. So a couple different audio reminders. You're going to have a lot of information today. You're going to meet a lot of folks, and don't worry, you're going to be getting a recording. So if you missed something or you didn't write it down fast enough, tomorrow you'll be getting a recording of today's program that you can go over, and you can actually share that with others. The other thing I want to mention is questions. They're an important part of this. We'll have some questions if we can get done in time. And for those that we don't get to, on the upper right-hand side, you'll see the ability to send us questions. And we'll throw those out to our guests, to our featured presenters. And those that we don't get to, someone will follow up. And they will have your information, so you can maybe hearing from them directly. So first thing I'm going to do is, as we get things kicked off, is we're going to find out a little bit about you. So I'm going to launch this first polling question. It says, are you currently employed? So this kind of helps them. And I am looking at the numbers. We'll leave this up for another 10 seconds or so. And this is very helpful. And I think healthcare is one of the few that could answer it with this strong of a response. So, and that certainly is not a requirement at all, but let me close this out, and I will share the results with everybody. So the majority of the folks are employed. 66% of the people are employed. No is 44% for those that might be on audio only. So like that question, and I'm going to do another one here. Do you have experience in healthcare? So this is a yes or no. Do you have experience? The other thing I'll add here is you can hear about some specific jobs, and then also you'll hear that there are more general jobs available beyond what you hear about today. So IU Health has lots and lots of positions that are open. So okay, so healthcare experience. Okay, let's share those results. About half, so 52% do not have healthcare experience, not a requirement for some of these positions. And yes, about half, 48%, do have that. And the last question I need to ask is kind of an optional thing. This kind of helps them as well. We're going to talk about a variety of positions today. What type of position are you most interested in? And the options are nursing, EMS, food services and housekeeping, or other. And interesting results on this one. Stall for just a second. Share these results. Okay, so other is a real big one, 78%. So that really helps today's presenter. 19% was the leader for nursing EMS, not quite yet. So maybe after today that will change. And, only 3% for food services and housekeeping. So with that, let's get things kind of kicked off. I'm going to turn it over to Summer Berardi. Summer is going to actually introduce the different presenters, and let's get this thing started. Summer, can you take the honors? Summer, remember to unmute.
You're on mute.
I muted it off my computer, not my phone. Sorry, guys. As I said, my name is Summer Berardi. I currently handle the EMT and paramedic positions, so all EMS for Indiana University Health. My colleague, Rafael Adeola, handles the patient care assistant roles. My colleague, Tom Ebenhouse, takes care of our surgical technician roles. My colleague Amy Nguyen takes care of our nursing positions, and then my colleague Nick Whistler handles all of our environmental services, food nutrition, and registration specialist positions.
Okay, so next up, I think we got a slide here about our Work One Central office. We need to thank these folks, and specifically Robin Branch. Robin, for all you do in that office and really throughout that part of the state. And I'll give a little description here of Work One South Central and all they do, and the Work One offices that are throughout South Central Indiana. So Robin, thanks to you and your team at Work One Central for putting this on. And with that, I think we're going to jump into this, right? So what's up next? I think we're going to have in Summer, if you can introduce the first person to introduce the first job. Yeah, there you go. So there's the group that we're going to hear from today, and where their specialties are. So make note of that. And I think we're going to jump right into job.
Well, I had already kind of previously introduced them, but my colleague Raphael, like I said, is going to be doing the patient care assistant roles, sometimes known as patient techs. Oh.
Okay, so here we go. So you're going to tell us a little bit about IU Health and kind of a big picture, right?
Absolutely. So a little bit about IU Health. We're one of the most comprehensive healthcare systems within the state of Indiana. Part of that is we have a really unique partnership with Indiana University School of Medicine. So something that's really intriguing for new team members with that is that that partnership offers innovative treatments for those team members to learn about like the latest sciences and things like that, and hands-on training. In terms of like professional growth experiences and like our unique personnel, there's a lot that IU offers. There's a lot of growth opportunities just within the organization, vertically and horizontally. As well, there's different opportunities to learn and develop in other meaningful ways that matter the most to you. And then one of kind of the overarching themes about IU Health is just that you will constantly find yourself doing challenging and meaningful work for the good of every patient.
Thanks, Summer. And now I think we're ready to jump right into some of these jobs. And this is just going to be a snapshot of the some, but certainly not all the positions, right?
Correct.
Okay, so we're going to talk on seven different opportunities, 7 areas, and let's see what the first one up is. And who on your team is going to take over? And so here we go. This is you, right?
Yeah, so this is actually me. Like I mentioned, I handle all of the EMT and paramedic positions. So currently we have EMT positions open. Those people are responsible for essentially providing immediate care for injured or critically ill patients. Most of our EMTs do work on the ambulances. We do have a few that work in the EDs as well. Same goes for paramedics. We do have lots of opportunities for paramedics in our area. Basically, we have them all riding on ambulances like I had previously mentioned. We do have positions available in Bedford, Bloomington, and Paoli. Something unique about those areas is they handle interfacility transports as well as 911 calls. So it offers a little bit more variety when it comes to the day-to-day work. We do offer positions full-time, part-time, and PRN. And we do work 12-hour shifts. So those are kind of the big things. They do have a week-long core orientation that they go through as well, just to prepare for training and learning best practices and things like that. Oh, and the hourly wage, it does start at $13 an hour, and it does go up from there based on experience in the space. But $13 is usually where it starts out for entry level.
Okay, Indiana driver's license, and okay, so who's next? Let's take a look here.
So that'll be me. My name's Nick Zwisler. I handle all of the South Central Indiana recruiting for the environmental services, food services, and registration specialists that we're going to be talking about here. The housekeeping position is the main function for environmental services. As it says there, we are really the front line of prevention in the hospital. There's going to be a lot of cleaning of all aspects of the hospital, including some of the shared spaces, all the way to the patient rooms. They're responsible for turning over a lot of the rooms as patients are discharged. So it's a very important role as far as the whole function of the hospital goes. There's really no experience needed. It is considered an entry-level role. They will train on the job, so no previous housekeeping or maintenance experience. You just have to be able to pass the background check and the pre-employment health screening. Starting pay is a firm $13. However, there is a shift differential for evenings and nights, so it can get as high as $14.25. They do kind of work on a grid, so there is, as you gain experience on the job, it will go up, but the starting pay is a firm 13. Lots of shifts available. We do day shift, evening shift, and night shift. So to give you a better idea what those look like, 7 a.m. to 3:30 p.m. would be a day, 3:30 p.m. to 12 a.m. would be an evening, and night would be 10 p.m. to 6 a.m. And as you see, those are our different facilities that we're currently recruiting for.
Okay, what's next?
Still me here. Food services, this is going to include cafeteria, some of the patient services, cooks, cashiers, dish room, variety of positions encompassed by that position name. Pay does start at 13 an hour. I'm sorry, I'm jumping ahead. Same as the other one, pretty much entry level, so all training will be provided. The only one that does require a little bit more experience is the cook position. They prefer to have somebody with cook experience there. But pay will start at $13 an hour for everything except the cook. That one would start at $13.25.
Nick, I did get a question come in here, a couple questions on both the food and nutrition side and housekeeping. Do people come in and is there a training program for those that don't have any experience?
Absolutely, yeah, they'll train on the job. They'll start with a job shadow to make sure that you feel comfortable doing a lot of the tasks, and then they'll train you on the job, including pay.
Okay, great.
Again, there's a little bit more rotating shifts available with the food services roles. There's some different needs. They don't have quite as much structure as far as the day, evening, night shifts as we do in the EVS department.
Bloomington only, or you take applications for some of the other sites?
Primarily Bloomington right now. We just had a position open up today in Bedford as a supplemental cook position. So it's pretty limited hours. I think it's about 12 hours a week.
Okay, so if their location is not listed and they're interested in one of these positions, still go ahead and apply?
Absolutely, yeah. We'll pass it around as things come open, and we could definitely send it to another location if they have something available. But we'll generally reach out and try to see what your preference is.
Okay, what's next?
I believe this one's me as well. Registration specialist is a little bit different from my other ones. This is primarily in our outpatient clinics, the Southern Indiana physicians' offices. This is really a front desk customer service role in a lot of cases, and they're kind of the person that sits there and greets the patients. They're going to schedule appointments. They're going to do some insurance checks. So communication skills is really, really valuable here, and we do prefer some customer service experience. Minimum requirements, just a high school diploma or GED, then like anything else with the hospital, the pre-employment health screening and the background check. The starting pay is a base 13, but we will take previous experience into consideration. The overall range, with having been there long enough, goes all the way up to the low 20s. So it's quite a big range of pay on this one. A lot of available shifts. It is being outpatient clinics, they are primarily days during the week. There are some weekends required with some holidays involved, but there are no evening or night shifts. It's almost always 8 a.m. to 5 p.m. And then we have these all over the place: Bedford, Bloomington, Martinsville, Nashville. Primarily Bloomington, but the others have at least 1 or 2 openings each right now.
Okay, thanks, Nick. And Amy, I know I did have some questions come in. I know the answer to it, but some questions that come in about benefits, and you're going to cover that at the end, okay? I want to let people know that. Okay, what's up next? Raphael?
Hi, my name is Amy Nguyen, and I recruit nurses for South Central region, specifically Bloomington, but I am able to speak to all of our other facilities in the South Central region. We are taking applications for experienced and new grads. Bloomington Hospital in general has a variety of positions open in the hospital in specialty units and then in our more diverse med-surg units. So a lot of new grads will typically kind of go more toward a med-surg unit, which is where you're going to gain a lot of experience. But then as you do gain that experience, you are able to move over into a specialty area, maybe a NICU or cardiac care, something like that. So we do try to get the best nurses available, experienced and new grads. We are a magnet hospital, so we do run by accreditation standards. So your school would have to be accredited by the ACEN or the CCNE accreditations. We are currently kind of looking for people everywhere all over Bloomington Hospital, of course, but I know that I have some position. Oops, sorry. I was trying to get my email. I have my contact gave me information about the other hospitals if anyone happens to have questions about that. You do have to have an Indiana RN license. We are hoping that sometime this summer we will be participating in the compact licensure. So if you have a license in another state, you are able to use that in Indiana, but more to come on that. Our pay starts out for a brand new nurse at $24.50 an hour. And then we do provide shift differentials. So we have a shift differential for nights, another one for weekends, and then a holiday shift differential. And all of our differentials are stackable. So if you work nights on the weekend on a holiday, you would have your hourly pay, base pay, plus $3 an hour for nights, $3 an hour for weekends, and then $8 for holidays. So in most locations, we have pretty much every shift available. I know that in Bloomington, our emergency department is trying to do a few new creative things with shift because not everyone wants to work a 12-hour shift. But for the majority of our facilities in South Central region, we do work 12-hour shifts.
Okay, Amy. So lots and lots of opportunities for nursing and
Yes.
specifically for RNs and anything on people coming out of school right now. Anything you want to add to those folks?
Yes, absolutely. So as everyone probably knows, Governor Holcomb passed a bill that because of COVID-19 right now, once you have graduated nursing school, you are eligible to apply for an emergency RN license without taking your boards, your nursing boards. So what that means is you would operate on an emergency license for 90 days. And given that the whole COVID crisis is on the downward spiral or it's over, hopefully, you would either reapply for another emergency license or you would take your boards to get your real license. So yes, we are accepting new grads that are graduating in May. I know for sure Bloomington Hospital, because that's the one that I specifically recruit for. I know that we do accept new grads for a lot of our units.
Okay, well, thanks for adding that, and that's actually happening then, right? So IU Health recognizes that, and it is actually happening.
Yes. I have quite a few that are starting actually on an emergency license, so it's a great thing.
Okay, good. Well, hey, and we'll pass that along to the governor's office. Thanks for adding that. And good. So next up is 6 out of 7, and that is patient care assistant. Is you, Raphael?
Yes. So my name is Raphael Adiola, and I recruit for patient care assistant, also known as patient care tech. Basically, this role is a bedside caregiver to patients in multiple departments. So basically, you're going to be working under directions of the nurse, and you're going to be providing that assistance that the patient needs. So it can be anywhere from taking a bath, helping them take a bath, using the restroom, doing their daily activities, and also checking vital signs as well too. So basically, you are working in the front line and making sure that that patient gets, back on their feet. So pretty much a lot of that, the position itself, a lot of nursing students are in that role, and obviously a lot of CNAs are in that role. So basically, that's kind of like the general explanation of that role itself. There's not necessarily any requirements, any work experience, related medical work experience that's needed for the role. What we look for is for people that have great customer service and continuing, work history. So if you've been at a position for, at least a year, you don't show on your resume that you're somebody that jumps from one position to another position, then, obviously, we're definitely looking for those individuals that are consistent in regards to their work history. And the base pay is, if you do have medical background, then we're able to provide a little extra money for you, but we do start off at $13 an hour. And we do work on a 12-hour shift. So basically, if you're interested in a day shift, it's going to be from 7 a.m. to 7:30 p.m. And if you're interested in a night shift, then it's going to be from 7 p.m. to 7:30 a.m. We do provide shift differential that starts at 11 p.m. So depending on what region you work in, the shift differential can vary from 125 to 150 an hour. And we do have available shifts from full-time, part-time, days, nights, evenings. So basically, we have a variety of shifts. So hopefully, that can definitely fit your schedule if you're interested in those positions. And basically, we have opportunities in Bloomington, Bedford, Paoli, and as well as Martinsville, which pretty much consists of the South Central region.
Okay, so if somebody's interested, Raphael, and they may not be listed there, get your application in, right? I'm
sorry, can you repeat that again?
So somebody that's interested, not necessarily in Bedford or Bloomington, still get your application if they want to be a patient care assistant. I did have a question come in here about training. So they're interested, no experience. There's a training program for this as well?
Yes, so we give them an opportunity to learn the skills. After they get hired, we do have what we call a core week, where you'll be able to do the basic training to understand the position. You'll be able to earn your CPR certification as well within that week. So we do provide the training on job training.
Okay, well, thanks for that. And I think this is the number 7 of 7 positions. Let's see if this is surgical tech. And I don't know if Tom is on or not, and if not, he's going to pick this one up. So Tom is on. So who can speak to surgical tech among us?
I can try to do my best. If you want to go ahead and show us the whole slide,
Sure.
I can try.
Yeah, bring the whole slide back. Sure. Yeah. There you go. I could have done that, Amy.
So Tom Ebbinghaus is our surgical technologist recruiter for the South Central region. He's not able to make it right now. So I will do my best to explain it. So of course, a surge tech is going to be someone that in the course of a surgery, they're going to be in there, they're going to be handing the nurse or the physician the tools. They're going to be prepping the room. They may be cleaning the room up afterwards. They probably, I would imagine, have a great deal of experience in sterilization of the supplies, the instruments, and things like that. They are there during surgery, so you would be present during the whole surgery. And looks like you would need a CST, a Certified Surgical Tech certification. So if you don't have one, from what it says here, they would give you 4 months to get that certificate. So I would assume in that 4 months, you're doing a lot of training, and maybe you're doing some things that you don't have to actually have the certification for until you get that certification. Looks like they have days, evening, and nights. We do a lot of emergency surgeries and a lot of elective surgeries. And of course, since elective surgeries mostly are on hold right now, most of the surgeries that we are doing are emergency surgeries. But once those, hi Tom.
I am here. I am so sorry. I apologize. I was on the phone call. I kept talking over you saying, hey, can you hear me? And I came in on a different link, and apparently I could see you. I could hear everybody, but they could not hear me or see me. So thank you. And I'm so sorry. I've been on the call for about 30 minutes. So you're doing well, by the way. But if
Jump right in, Tom.
I thank you so much, and I apologize for all this, but yes, you covered it very well, Amy. And I wanted to say that to become eligible for a surgical technologist role, one has to graduate from an accredited 11-month CST program. Those in the state who do offer that program are typically Vincennes University, Ivy Tech there in Columbus, also the Ivy Tech in Terre Haute, also here in Indianapolis, and IU Health Methodist also has their own CST program. Once one graduates from that program, then they will take their certification exam through the MBSTA. However, if one doesn't achieve that, you have 4 months to get that once you get hired on here to IU Health. The surgical tech actually works in the operating room. They actually, as an extra set of hands with the doctors, they make sure all the instruments are carefully laid out and available for that particular surgery. We have a number of positions right now in the South Central region, including Bloomington, Paoli, and down in Bedford. So I do recruit for that whole region down there. We do have the other requirement is having a BLS certification, which is the basic life support. That is a requirement. We do have days and evening shifts available. There is shift as well for that for those different shifts. We also have some that are 3 12-hours or 4 10s. We do work we're very flexible when it comes to schedules. So the starting hourly rate for somebody just coming out of school is $19.50. We do have PRN as well as full-time positions. And of course, the pay rates do go up per years of experience.
Hey, Tom, I got a question that came in here about, I'm sure it varies, but can you give a general idea, maybe by facility, how many surgeries in a typical day?
You're right. It does vary somewhat between locations. Bloomington, of course, is probably the biggest, and they could have up to 20, 25 surgeries per day. Some elective, some, of course, emergency.
Okay, so that's the surgical tech. And I think the next slide, I'm going to keep it with you, Tom. We've had several people ask about how to apply. So, you know, and some people that have already put their application in, should I reapply? Kind of walk us through this.
Yes, it's very easy. It's easy to start. Now, starting with those who have not applied, You go to iuhealth.org/careers. You register by putting in your email and setting up a password. Once you set those up, you can come back in as a recurring applicant. So all you have to do is click on that. You can do a keyword search regarding zip codes, of course, and then you can also put that out so many miles radius. So Bloomington is typically 47401, and then you can, but normally you can just use that. Then you hit search careers. You can do it by job code, job title, or if you know the rec number, you can search it by rec number as well. And you can apply to multiple positions. And again, it's real simple, easy to apply.
And today we discussed 7 positions, but there's lots and lots of positions open at IU Health, and that's where they'll find them. And it looks like you got a mobile version of that too, right?
Yep, that is true, and it's real easy. You can use your a mobile app just to upload your resume, or you can fill or your application. Takes about 5 to 10 minutes, and once you load it up, you can apply to any positions out there. Again, all you have to do is put in the zip code, the name of the position you're looking for. Again, if you know the job code or rec number, that is a simple way of searching as well.
Okay, well, thanks for that, Tom, and taking us through the application process. And I know we've hit the top of the hour or the half hour here. And before several questions coming in, Amy, I'm going to bring you back in to talk about benefits. I know that's an exciting part. What can you share for those on today about benefits at IU Health?
Okay, excited to share this. We have outstanding benefits, of course, you would imagine, being the largest physician network in the state of Indiana. We do have excellent benefits. We have several choices for medical. We offer dental, vision, life insurance. We have flexible spending accounts, healthcare savings accounts, and my favorite is the 401k program. It's an excellent program. The IU Health will match up to 4% of your contribution. So bi-weekly, if you contribute 4%, IU Health will match another 4%. So you have an 8% deposit into your 401k account bi-weekly, which is amazing. We also have tuition reimbursement. So if you're going for an associate or a bachelor's and it's not necessarily nursing, it's $3,000 reimbursement per year. If you are going for your master's or a doctorate, it's $3,600. But if you're going for a nursing bachelor's, master's, or doctorate, it's $5,250 a year, which is pretty nice. Another great thing about working for IU Health is we are a non-for-profit, which means that we do qualify for the Public Student Loan Forgiveness Act. And what that is if you have student loan debt, and you work for a non-for-profit, and it doesn't have to be just IU Health, but if you work for a non-for-profit and you make your scheduled payments on time for 10 years, you don't miss a payment and you're not late, at the end of that 10 years, the government will write off the rest of your student loans. So that could be a very, very big savings for a lot of people. Let's see, our 401k, our PTO plan is very generous. We do offer benefits for part-time team members. So the medical, dental, vision, and all of the health and welfare benefits are the same for part-time and full-time. The only difference would be PTO. So you would accrue your paid time off at a lesser rate as a part-time team member than what you would as full-time. So we have a ton of benefits. We offer
those are listed on the website. Those are also on the website, I assume, Amy.
Yes. Yep.
Hey, Amy, I'm going to keep it with you. I got to do that a question. I think you're, I guess, actually based in Indianapolis. It says, are there any registration specialist positions open within Indianapolis, Carmel, or Fishers? And I assume you still go to the same place to find that answer, right?
Yes. If you just want to go to the website like Tom was talking about and plug in, I would use 46204 for Indianapolis, and then you can careers there from the website and see if there's anything available. There are a lot of facilities around Indianapolis. We have Methodist, University, Riley. We also have doctor's offices. So lots of opportunity, I would imagine, in Indianapolis.
Okay, well, thanks for that, Amy. I want to bring Nick back if Nick is on and can come back on. Nick, there was someone that asked about if they can reach out to you specifically to address his resume and talk with you. That's possible?
Yeah, absolutely. I'd be happy to share my contact information, send my email address.
Okay. You'll see this when we get done. You'll see the very question, so you'll have that information to follow up directly. Okay.
Perfect.
All right, thanks for that. And I'm going to bring Summer back on. Summer, I got one for you here. If Summer is still there. Let me bring up.
I believe Summer had to take off for an early meeting.
Okay.
So to send any questions, she could respond.
Yeah, let me throw this one out.
That.
Yeah, well, here's another one that said I'm certified as a community health worker, and I'm also training for certification as a chronic care health professional. Do you hire for those roles?
A chronic care health professional. I do not believe that's a role that I have encountered in IU Health. I think the best chance is to just search the website. What was the other? It was chronic health professional and what else?
Chronic health and is a certified community health worker. So certified as a community health worker and then also in chronic health.
I can speak a little bit to the community health. At least in Bloomington, we do have a community health department, and they have community health associates and a few other levels of that, where they do some community outreach with local schools and some of the other programs that they've deemed necessary. So we absolutely do. I would just search the keyword community health for that one.
Okay, well, that's outstanding. Hey, we have hit and gone past our allotted time, but thanks for all this information. I've gotten several questions here about people asking about the recording. We did say that at the beginning, and this is being recorded, and you'll be getting a copy as early as tomorrow. So with that, I don't know if anyone else has any closing comments they want to throw in. I want to put you back on the spot, Amy. Anything else you want to add to everyone?
No, I just want to thank everyone for joining. And if anyone has any questions about nursing specifically, definitely get in touch with me. If it's not for the South Central region, I can definitely get you in touch with a recruiter from an area that you're interested in. But we just really appreciate you giving IU Health an opportunity.
Okay, so with that, we're going to close today's program. Thanks to everybody for your time today and sitting in and joining us. Lots and lots of really good opportunities at a variety of locations with IU Health. And again, a special thanks to our Work One Central office and Robin Branch and all they do. So with that, I see Nick and Tom and Raphael and Amy, and I know there's maybe a couple other ones on. So hey, thanks again for you guys for your time today. And let's conclude today's program. Everybody have a great day.
Thank you. Thanks for setting that up. Appreciate it.